Hi, Mr. Smith. Yes, I'm Megan. I'm one of the LVTs today that worked with your pets, Felix and Cole. How are you today? That's good, that's good. So I heard you have some questions about how much your dental is and why it is that much. Okay, we could talk about Felix first if you would like. Let me just see. Okay, his base cost of the dental was $915. That base cost includes the IV fluids, the anesthesia, the cleaning, the blood work, the hospitalization, the equipment used, and the x-rays. Okay, we can go over the dental estimate, the sheet that I gave you for Felix one by one, and then if you have any questions, you could ask me. Let's just go down the list. The physical exam with the oral exam is $75. We want to make sure that he is healthy for anesthesia and that how his mouth is looking to make sure that we do the right cost amount for the teeth cleaning. Next on our list is the blood work. So that blood work is going to cost $200, and that includes the CBC, the urine analysis, and the blood chemistry. Those three blood works just make sure that he can go under anesthesia and that he will be fine throughout the cleaning. And then hospitalization for aftercare, that is $50. And that just makes sure that after anesthesia that he is good, and then we watch over him to make sure that he is getting upright and he wakes up and that he's doing well. Let's talk about when he is getting the cleaning. So the anesthesia is $200. Anesthesia is just expensive. We are going to use isoflurane, and it's just expensive. There's no way to get around it. It's the cost of it. IV fluids, that is $100. We just want to make sure that he doesn't get dehydrated during anesthesia and that we keep his blood pressure up and everything like that. And then teeth cleaning, you could see that it says $100 to $300, but since he's only a grade 1, since he has like very little calculus, it is his annual cleaning, we're just going to charge $100 since it is a very basic cleaning. And then full mouth x-rays, although we do recommend it, for Felix it might not be necessary, but if you do get the x-rays, it is $150, and that's just to make sure everything looks good in his mouth. But since it is his annual dental and everything looks good, you don't have to do x-rays, but we do recommend it. And lastly is the equipment used. We will charge $40. It does say 40 to 65, but since he is a cat and we're not going to be doing any extractions or anything, it's just going to be the lower cost. And since it is just his annual cleaning, we probably won't be using that much equipment. So with all that, that means for his total estimate, the lower half, if you don't get x-rays, will be $765. And if you do get x-rays, that means it would be $915. Okay, let's go over the dental estimate for Cole. Let's see. Okay, so the physical exam with the oral exam, as I said before with Felix, is going to be $75. It's just to see what's going on and make sure he's healthy for anesthesia. Blood work is going to be the same amount as Felix's. It's going to be $200 for the CBC, urine analysis, and the blood chemistry, just to make sure that he can handle anesthesia well. And then hospitalization for aftercare is going to be $50 as well. So continuing down this list, his anesthesia is just going to be $200. Like I said before, anesthesia is just expensive. There's no way around it. His IV fluids is going to be $150. I know that's $50 extra than Felix, but since he is like a big dog, like bigger than Felix, which is a cat, then he's just going to need more fluids to maintain him during anesthesia. Okay, so teeth cleaning, since he is a grade 3, he has lots of calculus and everything, he is going to be on the higher end of the $300. And since Cole, as I said before, is a grade 3 dental, which just means the calculus and everything, we like highly recommend that he gets full mouth x-rays. And since we are going to do extractions and everything, it's just highly recommend. So since he is the bigger dog, it's going to be $250. And since there's a lot going on in his mouth and we're doing extractions, there he's probably going to need some extra anesthesia time. So after that 30 minutes, every 15 minutes after that, it's going to be $75 extra. And since there is a lot going on, it's probably going to be 30 minutes extra, so it would probably be $150. Okay, this part might seem a little confusing, so if you definitely have any questions, just stop me and I will answer them as best I can. We're going to go over the extraction part. I know that the doctor recommended that we definitely take 2 teeth out. I think there were a canine and a premolar. Let me just check. Yeah, so it seems like we're going to be taking the lower left canine and the top right carnassial, that really big tooth in the back. The doctor recommended that because the carnassial has some furcation. That means when the gum line lowers, there's like that little hole where the roots meet up with like the tooth. So since we can see that, we just want to take that carnassial out because it could cause issues. There could get bacteria in there, and then it just makes it a lot worse. And with the canine, it's very motile. It's still like in there, the root's still in there, so we definitely want to just make sure we take that out because it could just cause issues later on, and we don't want that. So this is the part where it can kind of get confusing on the dental, but since I'm here, I will go over it. So for the surgical extractions, we'll go over those first. It looks like we're just going to take out the canine, as I said before, one of those, and that's going to be $75. For the premolars, surgical extractions, there might be 1 or 2 that might get extracted, so whether we take 1 out or 2 out, it's going to be from $75 to $150. So that just depends while we're in there, what we extract and everything. And lastly, for the surgical extractions, the molars, we might not take any out. We might take 1 that seems a little sketchy. So depending on when we get in there, if we take anything out, it's going to be either $0 or $75. And just to clarify, every surgical extraction is $75. Okay, now we're going to go over the non-surgical extraction. And that's just if we get in there and it like falls out, or we don't have to use our tools to like try to get it out and everything. The incisors, the really cute ones in the front, 0 to 3. So 0 being none of them will fall out, all of them will stay in, and 3 of them kind of look sketchy. They're a little motile, so they might fall out by themselves. So if that does happen, it will be $150 for those all 3. And each non-surgical extraction costs $50. So since that's 0 to 3, 0 being $0, if there's 1, it'll be $50, and so on. Next is the premolars. From what our doctor can tell, there will be 0 to 2. So 2 of them do look a little motile. They look like they could be an issue. So it might be $100 because of that. Everything is $50. So the molars, 3 of them look like they could fall out. So if all 3 of them come out, it'd be $150. If 2 of them come out, it'd be $100. 1 is $50. 0 you won't get charged for. So we're gonna go over the equipment used and post-op medication. So for the equipment used, we will probably be using a lot of equipment, the gauze and everything like that, because we are doing extractions. So it would probably be on the higher end, $65, just because we are using a lot. And with the post-op medication, we do highly recommend it because he will probably be in a bit of pain since we are extracting teeth. So since he is a bigger dog, he will probably need a bigger dose, and it would probably be $50 for the medication. So for the total estimate for Cole, the low end, that's not including the medication, the x-rays, and the surgical extractions, like none of that happens with the non-surgical as well. it would be 1,190. And the high end, that's including the medication, the x-rays, and if we do extract all the teeth and the non-surgical extractions, all those come out, it would be 2,190.